if you're sexually active, this may not be the right time for you to get pregnant.
So there's many types of birth control to choose from. First of all, there's something that's called the Depo-Provera shot, and this will prevent you from having a period for up to 90 days.
Right. The Depo-Provera actually works within 24 hours after receiving the shot to prevent pregnancy.
And then you can also use the patch on your skin, which is a weekly. You put that on every week, and it also is good for birth control.
Right. A lot of girls don't like the patch, though, because it actually might slide off. They might forget about it. It might become uncomfortable if you're working out at the gym or something along those lines. It might be a bit cumbersome.
But if you're also a person that remembers what to do and when to do it, the birth control pill is for you. There's new methods out there that are very effective and low estrogen, so there's little side effects, and you take that pill every day.
Lower doses, better pills, hard to remember. Good work.
Okay, you can also use the diaphragm, which prevents the sperm from actually hitting the fertile egg that comes down out of your cervix. So that's a little rubbery thing that just fits over your cervix, and it's perfect for some people, and then some people don't like it. But if you don't like chemicals in your body or any additives, it's definitely the thing for you.
Right. The one thing you want to remember about a diaphragm is you do have to see an OBGYN for that, because it's actually specially fitted for your cervix.
Condoms, when used effectively, are 98% preventative of HIV and sexually transmitted infections.
Right. Condoms actually are a good barrier for preventing infections, pregnancies, and so forth. But a lot of people say they're uncomfortable, that they don't like to wear them, or, certain circumstances prevent some individuals from wearing them.
There are some types of lubricant that can help because it does prevent a barrier, but they're not really getting that good barrier protection out of lubricant just yet. But soon, we hope there'll be some on the market that will be helpful, so we won't have to use condoms all the time.
One of the things also with condoms that you want to remember is if you're wearing a condom and you have anal sex and then you want to switch to vaginal or vice versa, you really need to switch the condom out because it can lead to bacterial vaginosis and...
That's right, and if you're using a sex toy, you want to change the condom just as well because the disease can be carried on that sex toy. So condom the sex toy and change the condom. Every time you change the hole, change the condom.
There are some conditions actually that can cause something called bacterial vaginosis, which sometimes is a pH imbalance in the vagina.
And you can always tell when you have bacterial vaginosis because it's actually also known as smelly pussy. So if you have an odorous smell coming out of your vagina, pussy is not supposed to smell like fish, and you've got an infection happening. So you need to be tested for bacterial vaginosis. Bacterial vaginosis can also be caused by any types of foreign objects, lubricant, any type of lube or something that could be in the vagina. It could set off an imbalance, but you also can get bacterial vaginosis from a male partner. So it's important that you both get tested for bacterial vaginosis and get medicated.
And there's actually a type of bacterial vaginosis caused by something called trichomonas.
Yes, and you can always detect it because it does have that smelly odor coming out of the vagina, and it can be a very frothy white discharge, often like a cappuccino.
Actually, there are a couple of different kinds of staph infection, but the most common one, or the most serious one, is something called MRSA, which stands for methicillin-resistant staph aureus. Basically, it's a skin infection.
Yeah, you can detect it because it looks like a pimple that lasts a long time. It may be purple or red or a hard bump. It can be anywhere on your body. It emanates from the nasal cavity, and sometimes people can reinfect themselves. But it's very important that if you have this, because you can pass it on to someone else, that you come in to your doctor's facility and get tested.
Right, and actually the treatment for it is pretty simple. Sometimes you might need a shot, antibiotics, as well as some creams that you may put in your nose or on the skin itself. Very easy to treat, hard though sometimes to prevent getting it passed.
Yeah, so keep an eye on your body. Always check yourself. And by the way, when you check yourself for sexually transmitted diseases, remember, take a mirror off the wall, place it on the floor, spread your legs, stand over that mirror, and spread your genitals because it's very important that you take a good look at what's happening in your body. Take a look at all four lips. Take a look at that little spot of skin between your genitals and your anus and make sure that there's nothing there. Spread your cheeks. Give yourself a good look. And also, do that with your partner, because that's the way to detect sexually transmitted infections on yourself and on someone else.
Right. You might want to avoid the department store mirror.
What do you do if you're on your period and you want to be sexually active? Well, you can always use a natural sea sponge. You can get these in the store for a very small amount of money, and you can boil it for under a minute. Then take it, Squeeze it out over the sink, squeeze out all the excess moisture, and put it in the vagina at the base of the cervix, and it will absorb the blood for a good sex session. You can also use these up to 3 days. Every time they're full, every few hours, take them, rinse them out in the sink, and reinsert. It's a great way to avoid tampons if you want to have a good sex session.
Right. And for those men out there that have trouble with erections, I don't want to sound like a commercial, but there are medications out there that are available that include Viagra, Levitra, and Cialis. You need to see your medical provider about the side effects of these drugs, but typically it will help maintain an erection, but basically you've got to get that erection there in the first place.
Yeah, you've got to get it. The drugs will help maintain it. Douching can be harmful because it upsets that delicate pH balance of the vagina, so you don't have to use the whole douche. In fact, you don't have to use any of it at all. You can just rinse a little soap and water and 2 fingers in your vagina every month after your period or after a sex session, and that's just enough. Please don't upset the delicate balance of your pussy. It will appreciate you for that.
Stay safe.
Stay sexy.
Stay healthy.
Thanks for visiting SxCheck.